We're going to move on now to an NDTV special investigation, and it has to deal with COVID, and it has to deal with whether or not the actual numbers of COVID cases in this country are being accurately reported. Now, on the basis of unseen and unreleased official data, it's now quite clear that India is likely to be underestimating massively COVID numbers in the country. So what are we trying to say? While we have officially announced a rise of 95,000 to 1 lakh COVID cases every day, by far the highest in the world, the unreleased data suggests that it could be much, much higher, 2 lakhs to 2,50,000 cases, new cases every day. This is not only something that confirms that we are world number one, it puts us in an altogether different league from the rest of the world. Now, why are we saying this? Earlier, we reported that India's numbers were likely to be an underestimation because of the increasing reliance on the less accurate rapid antigen tests. It's already been established that antigen tests miss a large percentage of COVID positive people and declare them as being COVID negative. You can see over here what that actually showed was the number of antigen tests going up, as you can see underneath in the orange bar, and the number of PCR tests, which are considered more accurate if administered properly, to be going down. Now, according to literature, PCR tests, the RT-PCR tests, when conducted properly, do detect a much higher number of COVID cases, in fact 2 to 3 times higher than antigen tests. Now, this is clear. Why are we saying so? Because official data of Delhi and Maharashtra, which are known to have good practices, methodology and techniques of PCR testing, show this. The differential between the two tests is similar to global standards. So, positivity rate in PCR in Delhi is 14%, antigen just 5%. And look at the difference between Maharashtra, where RT-PCR cases, tests are indicating a 24% positivity rate, antigen far, far lower. Therefore, is antigen accurate in those with asymptomatic cases? Those who are asymptomatic, if they get tested by antigen, are they being released because they don't show symptoms? That's the big worry. However, the new data does indicate a disturbing development. Antigen tests are easy to administer. They require a simple blood test. PCR tests, on the other hand, in order to be accurate, need a much higher degree of skill and training. Now, if PCR tests are not carried out with checks and balances, the level of false negativity does rise. The new data suggests that this might be exactly what's happening in other parts of India. Now, stay on this for a moment, because based again on this recently accessed official data from all the other states, it is disturbing that the positivity rates of both types of tests should be almost the same. So, let's just change to the next page if we can. This is the all India positivity rate. You saw what it was in Maharashtra and Delhi. Now look at it from an all India perspective. Again, it's broadly the same, despite the fact that it has been proven in several cases, not just here, around the world, that PCR is a lot more accurate. Therefore, the question we are asking is, are the antigen tests which are being administered, are they being administered properly? Or in fact, I should say, are the PCR tests which are being administered, are they being administered properly? So, it's clear that if the positivity rate of antigen tests in India is around 7%, the positivity rate of PCR tests should be 2 to 3 times that rate, suggesting that the PCR positivity rate in India is likely to be around 15 to 20%. This means that instead of the daily reported 1 lakh new cases, the truth is that India probably has 2 lakh to 2,50,000 new cases every day. With at least 2 lakh daily new cases, we need as a nation to recognize that the reality on the ground is much worse than we acknowledge. It is a reality that requires vastly different medical and social policies that if the numbers were much lower as earlier believed. We need to change the way we are thinking, perhaps embrace the truth if we are going to defeat this.